Morning everybody, and it's great to see so many people here this morning. And I'll start off, because I don't know everybody in the room, so I'll start off giving you a bit of a background to myself and a background to how the AHSN was formed. So I've been at the AHSN full time since last January. Prior to that, I was in the NHS for 12 years in a variety of different organisations. And my last post was Chief Exec of the Walton Centre, which is a Neurosciences Foundation Trust in Liverpool. And I also chaired the Cheshire and Mersey Comprehensive Local Research Network. As I was one of the founding members of one of our research hubs in Liverpool. So really passionate about research, innovation and its ability to change the lives of residents across our region and across the country. Prior to that, I had a 17-year career in local government, so I do know that world quite well. I worked in social care, housing, running all the customer service centres for 3 councils. And I did have a period of time in the private sector as well, and I've also run my own business for a couple of years, but I got a little bit busy with my public sector work. I was running it alongside that. So I came into this job really passionate about what we could achieve together for the benefit of residents across the region. And the more I get into it, the more benefits I see that we can get out of working together in partnership right across the NHS, academia and industry. And we've got some fantastic partners who are so enthusiastic in this region, and I do think that sets us apart actually for some of the other regions about how we work together and how we work in partnership. So in December 2011, I was on the train coming back from some London meeting, and there was 2 policies that came out, and one was the government's life science strategy and one was innovation, health and wealth, which looked on the surface a bit dry. It was a Treasury document, but it was all about how we pull together innovative techniques, procedures and products to improve health and improve economic growth. And the more I read it, the more I thought, this is absolutely fantastic. And the foresight in the document was brilliant. And in there was a mention of something called an AHSN, and I thought, that sounds a bit interesting. We had a 2-year journey, I think, to getting the AHSN set up and licensed, working with NHS England, the Department of Health and the Treasury, and colleagues in this room were involved, Tony and John, and people behind the scenes in getting us set up. And I think, as John said, we have gone from strength to strength in this region because of the strength of our partnerships and working together. So we have tried to build on that, and our first year of business has been building up these partnerships, obviously working through people, because it's the people that deliver the work, but trying to network networks of people together to get a really good result at the end of the day from those networks. And we've started doing some work on the ground. So obviously we have meetings like this with academic partners. We have our European Connected Healthcare Alliance, which is about e-business and health. And we've just launched our Innovation Scouts, and that's pulling together key people from our NHS partners who sit between the board level and still have contact with the front line to really scout out ideas of innovation, to look for opportunities and to think about the cultures in those organisations, because we can have businesses working on products, we can have universities generating fantastic ideas and training, but if the culture in our organisations isn't ready to receive that, we're not going to get very far in improving the health of citizens. So we've got a range of things that we've been doing across the patch to try and work through people, systems and partnerships to deliver to residents. We were really ambitious at the beginning of setting up as an AHSN, and we used a smart specialisation process to look at the region and to really think about, in all of our organisations, where are our strengths, and we had loads of them actually, so we just thought, right, we're going to go for all of these and we're going to be a national leader in these areas. So we've worked on digital health, infection control, musculoskeletal, neurology, and we've got some really key achievables in those areas. And one of the key strengths of our region is personalised medicines. And last week we submitted a bid to the 100,000 Genomes project to be one of the 6 centres in the country to run that. So we've had lots of things going on, and the things that we're already good at and that we've built on. We have 8 what we call campaigns that we report on to NHS England based on these strengths. But we also have a plan on a page of things we wanted to deliver in our first year in business, to try different things out, work with different partners, and some of those have really developed into very strong work streams, such as our mental health work stream, working with all the NHS organisations of social care across the region. Looks like it's going to be an exemplar project for us to lead forward. We've tried to pull together a health innovation system, thinking about obviously workforce and people, the structures we put around that to encourage development of innovation, what systems we can put in place to encourage people to work together and work through, and support initiatives. So we're working very closely with some partners. In our Patient Safety Collaborative, we work with a health innovation hub called Aqua, and they deliver health improvement programmes. So we've tried not to duplicate anything across the system, but if somebody's already doing something, we work with them to deliver it through them. So these slides will come round, so there is detail in there if you want to look at the detail. So we've got a list of our key partners and groups, and John has a really nice slide that actually hasn't gone into his presentation, which is about sort of the solar system of our partnerships across the region. And as you can see, there's loads of them, and they're growing because we all need to work together to improve health and promote economic growth. So I'm just going to give a bit of detail, practical detail about one of our campaigns. And this is a stroke and atrial fibrillation campaign. And across the region, we have got a big issue with stroke. I mean, most of you will know that our region, although it's fantastic, we have massive health inequalities. And we had a really big problem with people not having strokes detected before they happen, so not having prevention. And what we picked up from sort of local and national sources, if you have a stroke because you've got an atrial fibrillation, so an irregular heartbeat basically, that is absolutely devastating. You normally don't get back to work, you need carer time. In terms of health economics, it costs a lot of money to treat people and to keep the ongoing treatment going. So we decided to focus on this, and we also had a European partner. There was a European Year of the Brain campaign this year, so it tied in really nicely to some wider work that was going on across Europe. So we wanted to look at what outcomes we could achieve. And obviously in year one, we can't sort of measure how many strokes we've reduced, but we did want to improve the identification of atrial fibrillation. And we wanted to work with industry to look at how we did that, work with our GPs because they can diagnose that at the point of contact, and also work with some of our community agencies for people who normally wouldn't visit a GP or might ignore symptoms. How do we work with them to get the AF identified? So we ran a campaign in June 2014, and we worked with Liverpool and Everton football clubs and with Liverpool Health Watch to get those sort of unusual suspects into places that it wasn't a healthcare environment. And together we tested 400 people. So we were supported by our NHS trusts. The community organisations did some really great work, and I don't know if you've seen Everton in the press recently, they've been winning all sorts of awards for their health innovation in the community. That led on to us identifying some AF cases and also some other things. We had some really great nurses from Liverpool Heart and Chest and the Royal Liverpool who helped us with this and helped people to look at other things that were causing health problems. GPs were asking us for something that was really easy to test people. So we bought some equipment called a live car that they can have in their surgeries, which is really cheap and enables them to do an AF test really quickly if somebody comes in. We're also working with Professor Mear Mohammed, who is a professor in personalised medicine, to look at how we actually, if we find an AF or if we find an irregular heart problem, how do those people get treatment? How can we tailor it for their needs? So it fits very well with the personalised medicines approach. And we're starting to roll out some phenotype testing so that warfarin or anticoagulant prescribing is tailored to that person. And we had real success when we went around talking to some of our GPs in the region. There are lots of drugs out there for anticoagulation, but the GPs were reverting to warfarin because they knew it was cheaper and not offering a range of options. So warfarin might be the best product, but they weren't offering the range of options. And in our region, we had 7% of GPs who would sit down with people and offer the options, and now I say that should be 100% of GPs. So working through other sources and sort of a bit around the back door, we managed to work with some of our meds management leads to look at this. And Liverpool CCG, which is one of the biggest in our region, have decided that all their GPs will now offer anticoagulative therapies right across the board. So we have had something that wasn't actually our initial outcome, but when we started to scope up the campaign, we realised there was another problem we hadn't even thought about. So that campaign will keep on rolling out and we'll be measuring outcomes over time. So we've talked quite a lot about people and getting innovative solutions into training, into the workforce. We are supporting a programme that's been commissioned by NHS England through the local workforce and education group to look at how our workforce needs to flex to meet the needs of a local population, but how we can think about it being more innovative and what do we need to do. And this actually has prompted a whole range of requests from NHS trusts saying, we know our workforce needs to change, we know we need to do things differently, can you focus on these areas? So for example, 7-day services, overheated A&Es, we've had a request in to look at that because that will need to change. How do we keep people out of hospital? So this piece of work is rolling out across initially Cheshire and Mersey, but obviously what we would hope to do is to roll it out right across the region. It's funded at the moment by Cheshire and Mersey. So we'll be of interest in joint training programmes, and we know some of you run joint training programmes for health and social care, but we anticipate that will be one of the outcomes from this. So last year, because AHSN, the pathway of getting them set up was quite slow, and the money coming down from NHS England was quite slow as well. So at the end of the year, we had a small cohort of staff, and we did have some money that we could invest into the region. So we were trying to invest in things that would build up infrastructure, so not just one-off projects, but things that would go forward and put real value into the region. So we put some money into data interoperability. We used to call this our big data programme. We now call it our intelligent data programme because that's got such a bad press. But we've worked with 2 systems in the region, with Liverpool and Lancs, to build up their data interoperability programme. And our approach has very much been, we don't require everybody to have the same system. Across an area as big as this, that's not realistic. But what we would like is that systems talk to each other. So, for example, in a few years, if we want to go to those systems and look at how we're treating patients maybe with diabetes, we can do that on a system level and plan services around those residents. We want to create jobs, so we've been looking at innovation hubs in Liverpool, Lancs, and more recently in Chorley. How do we invest in those regions to pull down monies from the local enterprise partnerships and other sources to bring jobs and business incubation space into the region? So we've invested in some of those key projects. We have got 4 local enterprise partnerships in the region. We've engaged really quickly with 3 of those. And one has been a bit slower to engage, and Robin and I met with them a couple of weeks ago, but it's been down to personnel. I think they've had one and a half people to work in the LEP, whereas the others are more resource than that. So we've got a programme with the LEPs, and we've invested money in the LEPs to attract small and medium-sized enterprise into the region, or to help those that are already in the region. We've invested in a health economics team for the region, so let's look at what we're doing. Does it add impact? Is it worth doing? So we can be really systematic about it. We put some money into Alderhay Training Centre. That's one of the paediatric hospitals, and it's a regional hub for paediatrics. So we wanted to make sure that innovation was represented in their training programme. And Alderhay actually are a really good digital case study. They're building a new hospital, and they've planned all their pathways around digital and how they can do things differently. So it's worth sort of looking on their website. They're talking at our celebration event next week to just see what they're doing and how innovative it is, and can be a real exemplar actually across Europe. We did a very small piece of work with the University of Cumbria and CSC, who are a big IT company, around what would an area need to be ready to accept digital solutions and telehealth. So in resource terms, it was a really small piece of work, but actually in benefits, it's been a really good piece of work. We can look at what ground rules need to be in to try and put some of these solutions in place. Because if we just put digital solutions onto old ways of working, we don't get anywhere and we spend a lot of money. So we've been asked for this case study right across the country actually, just to learn some lessons from that. So that's been a really good piece of work. And again, Alison Marshall's talking about that next week at our celebration event, but we've got more details if anybody wants that. And very recently, we've just put some pump priming funding. I'll put the wrong title here. It's a Cheshire Innovation and Healthcare Service. And this is a research hub in the Cheshire region with the University of Chester, the Countess of Chester Hospital and Cheshire and Wirral Partnership. And part of our input has been some pump prime funding, but also to look at how we develop with them a really good research and innovation hubs. So we've got 3 hubs across the region that we can work together as an academic health science system to show how strong we are together across the patch in research and innovation. So we hope all that's been money well spent and will come to fruition in future years because we've invested in some of those things. I won't go through this slide. This is just about some of the work we've done around supporting funding bids. And the interesting bit, we've got some big funds that we're waiting for results on. So one of them, we applied for the Integrated Digital Care Fund to support Lancashire in its interoperability work. We hear about that today. So we're all on tenterhooks actually. We've applied for £500,000 and everybody who hasn't been successful has heard so far. So we are hoping that is going to be positive. So we don't know, but hopefully we'll hear today. I've talked a little bit about the 100,000 Genomes project. That started in Liverpool because of the expertise in the region, but now includes in that bid Lancashire and Cheshire. How can we use the hospitals to test people? We've applied with 5 local authorities across Mersey for a Transformation Challenge Fund to enable them to work together and to deliver more together. So we've been involved in that. And then around our mental health programme, working with the trusts in the region, we've applied for a Health Foundation Fund. So there's lots of other things we've been doing that are smaller value, but these are some of the big value funds that we're awaiting results for. And I think the thing is, when you start working on these things, even if you don't get the monies, which obviously that's what we're aiming to do, lots of things come out of those partnership work, and we think, well, we'll pick that up anyway within region and make that happen. So we do also, as well as working with our local enterprise partnerships, we do work with an organisation called the Northern Health Science Alliance. And this is really about the Northern Powerhouse concept, working together to pull business and to look at the reputation of the North. So we work closely with the 4 AHSNs in the North. We meet on a bi-monthly basis to share what we're doing, look at how we can work together more closely. And the Innovation Scouts concept, that is an AHSN of the North concept, we're working together on that. So the NHSA pulls together 8 of the big universities, 8 of the biggest NHS trusts, and the AHSNs into an alliance to lobby government really about bringing business to the North. And it does seem like with a lot of other range of interventions, we are being successful in getting that message across. And George Freeman, the Life Sciences Minister, was up here on Tuesday and was talking about AHSNs, talking about NHSA, talking about the Northern Powerhouse. So the message does seem to be getting through. And some of you might have met Hakeem, who was the Chief Executive of that organisation. Very dynamic, linked into every politician, and really knows how to get us represented in the system. So that's been a really powerful alliance for us. So we've been awarded 2 LEP contracts to assist health small and medium-sized enterprises, and all our LEPs were interested in health, but I think didn't really know how to go about getting it into their innovation plans. And we've been successful in working with them to look at how they do that. And it's not always been easy, because sometimes we'll be offering it, we'll say we can work with this NHS Trust and this will work, and the NHS Trust hasn't had capacity really to work on it. So that's where we can add some of the value in assisting the LEPs in looking at what their programmes might be. Now this one doesn't sound exciting, but actually it is. So this is about the NHS procurement pipeline is really complex. So, and having sat in an NHS trust, I didn't realise it was this complex till I came out of it and started looking from the outside. If I was a business trying to get a product into the NHS, how would I do it? It is really complex. So we've set up a national group. We've taken on the national lead for this. When we volunteered for this, the NHS England nearly bit our hand off because nobody wanted to volunteer for it. But it's turned out to be a really good work stream. So we've worked with national procurement advisors, our local procurement hubs, who are really innovative actually in this region, to look at how do we get small businesses into the procurement pipeline. And we've had some really good examples recently of 2 companies we've been working with. And when they've come to tender, they've got fantastic products, but when they've come to put something on the tender, they can't do it because one of them didn't have a turnover of £1 million, and they're a small business, they're not going to have that. And one tender specified that the company needed to have 2 products in operation, and what their product is a non-latex glove that applies right across the NHS, but they didn't have 2 products. So we challenged both of those tenders that had gone out at a national level and with the procurement hubs nationally, and we got them through the tender process. And Lee Invasion, the company who produces the gloves, they've gone on to win other tenders in region. So we've had a real success story with them. And the other one, Medipad, similarly has got into a lot of the NHS trusts in our region. So what we now want to do is to get them into NHS trusts nationally. So obviously it's a bit more complex than that, but that's just 2 examples of what we've been doing to really get some case studies around, look NHS, this isn't working, let's look at this differently. And we had a procurement conference at the end of November, which actually was really good and really interesting, with businesses coming to talk to us. We had national people there to look at how they could impact the whole system. So obviously you know about the academic programme. We have set up some expert groups around some of our lead areas to look at working together, what can we impact on and what lessons can we learn. And they seem to be going really well in putting people together for a scope of wider action than they could have achieved. A lot of you will know about our patient safety collaboration. Looking forward, the AHSNs have been asked to run some collaboratives across the region focused on making care safer and more systematic. So we had a stakeholder event where we had lots of people there. We had over 60 people there looking at our local priorities for this. So we're focusing on medicines optimisation, reduction of sepsis, transitions between paediatric and adult care, which is a problem across all systems, and we felt we really wanted to look at this because of some of our problems in region, and hydration, which obviously affects healthcare right across the board. So we've got 4 real sort of meaty pieces of work there. We put out a preferred provider document, and the lots have been awarded to Aqua, who I talked about earlier, our health improvement arm, Halo, who are an organisation who look at measurement and monitoring, and Edge Hill University to evaluate the programme, and also to do some online learning packages for staff who can't get off the front line. So we've got a really strong programme building up there right across the patch. And all 15 AHSNs are working on this. One of our key areas is medicines optimisation, and there's 10 out of the 15 working on that, so we're pulling together a cluster group so we learn from each other. And I think I'll whiz through those and just sort of come to the end of that. So what added value do we think that we're giving at the end of the year? And you will obviously be able to feed back on this, whether you think we are or not. So bringing partners together so we can impact on things together and have a wider scope of action and improve the reputation of the region because we're working together for benefit of residents. We think that we've worked with industry to say, actually, you've got a fantastic product, but if the NHS doesn't want it, don't carry on with it. Or actually, you might have a product that's a germ of an idea. How can we help you and support you in introducing you to people in the NHS who can work with you to develop it? So being very pragmatic with them. We do feel that we've got a trusted broker role. We are mainly funded by NHS England, apart from some of the contracts that we've won in, so we're not sort of dependent on local commissioners. We have put some match funding in that we hope will reap benefits, and we're looking at how we might be able to do some of that in this year. We're starting to get very much involved with our CCGs in how we might impact on some of their resident and patient pathways with digital health, because we've got some fantastic digital businesses in this region. And one of the things that we've been really keen to do is promote our region. We've got some fantastic universities here, fantastic NHS trusts. Our local enterprise partnerships are really keen for businesses to locate here and to assist them. So we hope we're doing a good job on promoting the North West Coast as well. Let's finish there, Chair.
That's excellent.